In the mid-19th century, childbirth was a perilous journey for many women. Maternal deaths from infections, known as puerperal fever, were tragically common. But in the heart of Vienna, a revolution in medicine was about to begin. This condition caused fever, infection, and sepsis, leading to death in many cases. Physicians at the time had no understanding of germs, bacteria, or the reasons behind the high maternal mortality rates. Ignaz Semmelweis, a Hungarian physician working in Vienna's General Hospital. In 1847, Semmelweis was placed in charge of two maternity wards, one staffed by doctors and medical students, and the other by midwives. He noticed a stark difference between the two wards. Women in the doctor's ward had a much higher death rate from puerperal fever than those in the midwives' ward. This puzzled Semmelweis, as both groups were attending to the same kinds of patients. While contemplating this mystery, Semmelweis had a breakthrough when one of his colleagues, a pathologist, died after accidentally cutting himself while performing an autopsy on a woman who had died from puerperal fever. The symptoms of the pathologist's illness were strikingly similar to those experienced by women suffering from childbed fever. This led Semmelweis to a crucial realization: doctors and medical students, who often performed autopsies before attending to women in labor, were inadvertently transferring some kind of particles from the corpses to the living women, causing the deadly infections. The midwives, who did not perform autopsies, had much lower death rates in their ward. Semmelweis proposed that doctors and students should wash their hands with a chlorine solution before attending to women in labor. Once this practice was implemented, the maternal mortality rate in the doctor's ward dropped dramatically, from nearly 18% to just over 1%. Despite these remarkable results, Semmelweis faced strong resistance from the medical community. Many of his colleagues were offended by the suggestion that they were responsible for their patients' deaths. The idea of invisible particles, or germs was not widely accepted at the time, and Semmelweis was eventually dismissed from his position. His ideas were largely ignored for years. Semmelweis' work laid the foundation for later discoveries in germ theory by scientists like Louis Pasteur and Joseph Lister, and today, hand hygiene is a fundamental part of medical practice, saving countless lives. Though he did not live to see his ideas widely accepted, Semmelweis is now recognized as a pioneer of antiseptic techniques in medicine, earning him the title of the "Savior of Mothers."